Now the notes say that you're suffering with some eye twitching.
Yeah.
It's not happening at the moment. So when is it?
It seems to happen mainly in the morning.
Okay, and how long does it go on for?
It's kind of on and off.
Okay. And for the rest of the morning or just for an hour?
Like throughout.
Okay. And is it painful?
No.
So it's literally just the twitching?
Yeah.
In terms of your sleep, I guess that's the most obvious question to ask. How much sleep are you getting?
Well, I do get about 8 hours.
Okay.
So
you're getting enough sleep. Okay. What I think we'll do is test all of your cranial nerves. Okay, it could be caused by perhaps something wrong with one of the nerves. Okay. I don't think it will be that, but I just want to double check. Just going to pop some gloves on. Alright, just going to start with a visual exam. Just look down and up. Okay, just relax. Okay, you haven't hit your head or anything?
no.
Okay. Alright, I'm going to start first with the trigeminal nerve, and as part of that I am going to just check inside your ears.
Okay.
Okay. Okay, just turn your head the other way. Okay, so eardrum looks quite healthy. Now, I'm going to try and trigger any pain from the trigeminal nerve. See if it sends any shooting pains to the eye, okay? So you just let me know if you feel anything. Is that painful? Okay. So the trigeminal nerve sits about here and it branches into the face. So some people that have any issues with their trigeminal nerve do actually get issues of their eyes. So that's why. There's no pain there. Clench your jaw and relax and swallow. It's okay. Just gonna. Okay, I'm not triggering any pain.
It's a bit sensitive.
Whereabouts?
Yeah.
Here? Do you clench your jaw when you sleep?
Yeah.
It might be that. So, there's no pain. About there.
It's quite sensitive.
Okay. Alright. Just going to try and trigger the twitch. Alright, I'm going to check your optic nerve now. I'm going to focus more on the actual eyes itself. So, I'm just going to come quite close. If you could just, I'm going to do this eye first. Just look at my ear. And if my ear, you can't see it, just kind of look straight ahead where it would be. Look up. Okay, let's blink. Look down. Your eye does look a little bit inflamed. Okay, let me have a look at this eye. Look down. Look up. Interesting. Okay. You have a couple of burst blood vessels that have healed on this eye. Do you get bloodshot eyes a lot? Okay. And do you know what has that been diagnosed as anything?
No, not that I'm aware of.
Okay. Alright. Just looking at my finger here. Okay. You can see that, okay? You can see I've changed that, okay? How many fingers now?
5.
Okay.
1.
Alright. I'm just going to get you to read the first sentence. Here.
Though certainly developed on a less grand scale, the imagery of unfulfilled longing.
Yep, that's fine. Those 3 words.
Who will rescue?
Okay, perfect. Alright then. Let me just... Okay, if you could just look straight ahead. Okay. Okay. Alright. Okay, if you could look up with just your eyes, okay, and down, look that way, and this way. Okay, now just follow my finger. I'm just checking the ocular motor nerve. Ideally, we're trying to trigger the twitch. Okay. Alright, just rest your eyes. Okay. I'm going to apply some pressure onto your eyes, alright? So just close your eyes. Just some slight pressure. Any pain there?
No.
Okay, close your eyes again. Any pain?
No.
No? Okay.
They're just very itchy and dry.
Even now?
Yeah.
Okay. Is that usually, they usually feel like that before the twitching?
Yeah.
Okay, they itchy and dry all the time? Okay. Just look straight ahead. Just gonna have a closer look. Just gonna look at your tear ducts. Okay, sorry, just blink. Do you get an excess amount of sleep in your eye when you wake up in the mornings?
Yeah.
Okay, what do you do to get rid of that?
Recently I've been bathing it in some water.
Okay. Is that tap water?
Like a eye wash.
Okay. And where do you get that from? The chemist?
Yeah.
There is a chance that you may be allergic to the eye wash. Your eyes do look quite inflamed, and given that you've been using an eye wash, they shouldn't be. It should actually be helping. That could be one of the causes, but let's investigate a bit more. Okay, I'm going to check your facial nerve now. So the facial nerve, it's responsible for sensation across the face. Okay, so I'm going to do some tapping. If you could look straight ahead.
Okay.
Could you feel all of that? Alright, I'm going to just either do that or that. Do you feel the difference between the two? Okay. So close your eyes, and I'd like you to say soft or sharp depending on what you feel. Okay.
Soft. Sharp. Soft.
Yep.
Sharp. Sharp.
Yep.
Soft. Sharp.
Yep.
Sharp. Soft.
Yep.
Sharp. Sharp. Soft.
Sorry. I'm going to just do some tapping across the face now, okay? What I'm looking for is any areas of numbness, tingling, or where you can't feel it. Okay, did that all feel alright?
Yeah.
Okay, I'm going to try and target the nerves that are slightly deeper. Okay, so if you just give me your hand, this is what it does, it just pinches. Okay, so I'm going to try that on the face. Okay. And you just let me know if it feels numb or tingles. How did that feel?
That was all okay.
Yeah? Okay. Alright, if you could just copy my facial expression, so... Okay. So I'm just going to feel... Okay, could you just shrug your shoulders? Alright, now try again. Okay, and turn your whole head the other way, up and down. Okay, relax. If you could just put your hands like this, I'm going to try and close your fingers and just push back. Okay, if you could just push against my hand. Alright, and the other side. Okay, perfect. Alright, so the accessory nerve seems good. Can I ask you to open your mouth slightly? Okay, and can you just swallow? Okay, just... Alright. Your glands are slightly swollen. I don't suppose you use a vape, do you?
I do smoke.
Okay. It's like your immune system's slightly on edge. Okay, just relax there. Alright. Just look straight ahead. Alright, I'm just going to check your vestibular cochlear nerve. Okay, so can I just get you to do this side to side? Yep. And the other side.
I can't do that side.
Oh, have you got...
I slept funny last night.
Okay, not to worry. Is there just some muscle pain here? Okay, that's fine. Any issues with your balance then? Dizziness?
No.
Okay, just looking at the yellow pen. Okay, still looking at the yellow pen. And now look at this. And then the yellow pen. And then this. And the yellow. And then this. Any pain? Dizziness? Feelings of pressure in the eye? Okay. I'm just going to check your, if you don't mind, I'm just going to check for your heartbeat. One of the nerves that comes off the brain is responsible for heartbeat and your circulatory system. Okay, and can I just have your wrist? How long has the dryness of your eye been going on for?
Quite a few years.
Okay. And you've always used the eye wash?
That's actually quite new, the eye wash.
Okay, what was happening before?
I just kept picking them.
Okay. That's probably what's caused some of the bloodshot eyes. Okay. Alright, just relax there. Is the twitch, whereabout on the eye is it?
Sort of.
Just point on your eye to where it is.
Here.
On the end.
Yeah.
Just close your eyes. Just gonna pinch it slightly. Just follow my finger. Okay. So, what I think is going on is, although you're not tired, you're not physically tired, you're sleeping, or mentally tired, you are sleeping quite well. I think the dryness of the eye is causing local irritation. Sometimes that can lead to things like twitching. It's not something we see all the time, but my best bet is due to how this eye is a lot worse than that eye. You don't get any twitching on that side?
No, I don't. Not that I've noticed.
Okay. So I think that what we need to do is approach the dryness and then see if that has an effect on the actual twitching.
Okay, yeah.
So I'm going to recommend this brand for the eye wash. I'm just going to make a note of where you can get this. It is over the counter, but it's not something they usually give you.
Okay.
You might have to try a couple of different chemists There's no point me prescribing it because it's cheaper than the prescription price. So I'm going to say, even if you're not getting the dryness, you do 2 washes in the morning, 2 washes in the afternoon, okay? And then you're going to have to try really hard not to put your fingers in your eyes, because that is going to be causing more damage, okay? So what I'm going to suggest is you come back in 3 months and we do another test and just see how it's going. Alright.
Thank you.
It's alright. Just make sure